Starting an in vitro fertilization (IVF) journey can be exciting, but it also might be overwhelming. We will guide you through the process every step of the way. In this video, we cover the basics of IVF and various treatment options available. IVF is a complex medical process that helps people who are having trouble conceiving, are at risk for future infertility, or to prevent passing genetic disorders to their child. IVF is one of the most effective forms of assisted reproductive technology, or ART, available today. It involves combining eggs with sperm in an embryology laboratory to create embryos, which are then transferred to a uterus. One full cycle of IVF takes about 3 weeks to complete. IVF may involve eggs, sperm, or embryos from a known or anonymous donor. In some cases, a gestational carrier, someone who carries a pregnancy for intended parents, might be used. Ovarian stimulation. The first step in the IVF process is to stimulate the ovaries with injectable fertility medications to produce multiple eggs. These medications stimulate egg production and maturation to increase the probability of pregnancy. Patients will typically self-administer 2 to 4 injections daily for about 10 to 14 days, depending on your treatment plan. The ovarian stimulation phase will usually include 3 to 4 clinic visits for ultrasounds and blood draws to monitor ovarian activity. The response to fertility medications varies according to the patient's age, ovarian reserve, and the amount of medication given. Egg retrieval. Once the eggs have matured, they are removed from the ovaries through a minor surgical procedure called an egg retrieval. This procedure is done under anesthesia with transvaginal ultrasound guidance. The eggs are collected through a thin needle inserted through the upper vagina into the ovaries. The egg retrieval is a simple and commonly performed procedure which may last anywhere from 10 to 30 minutes. The patient will then be taken to the recovery area where they will be monitored for about an hour while they recover from the anesthesia. Some discomfort is expected, and medication for pain or nausea may be administered. After about an hour, when the patient is fully awake and relatively pain-free, the recovery nurse will provide instructions and the patient is discharged. The patient must be accompanied by someone who can drive them home and stay with them for the rest of the day. Most patients can return to their normal daily routine the following day and expect only mild cramping and spotting for 2 to 3 days. After retrieval, the eggs are assessed in the embryology lab for maturity. Mature eggs are either inseminated with sperm or frozen later the same day. Sperm collection. Sperm is usually provided fresh on the morning of the egg retrieval. However, sperm can also be collected and frozen ahead of time. Sperm is most commonly collected through normal ejaculation in designated collection rooms at your fertility clinic. For men who do not produce sperm in the ejaculate, more advanced sperm retrieval procedures, such as aspiration or extraction from the epididymis or testicle, may be required. For optimal sperm quality, it's recommended to abstain from intercourse for 2 to 6 days prior to the IVF procedure. If donor sperm is used, it will be thawed and prepared by the laboratory staff on the morning of the retrieval. Fertilization and embryo culture. Fertilization occurs after eggs and sperm are combined in a laboratory dish. There are 2 common methods to achieve fertilization: conventional insemination or intracytoplasmic sperm injection, ICSI. In conventional insemination, the sperm and eggs are incubated together overnight in a dish for the fertilization process to occur naturally. In ICSI, a single sperm is injected directly into each mature egg. The embryologist will examine the eggs on the day after insemination to assess fertilization. It is not expected that all eggs will fertilize. Fertilized eggs or embryos are incubated in a controlled environment and monitored for growth and development for up to 5 or 6 days. On average, about half of the fertilized eggs will continue to develop normally and can be considered for transfer. Normally developing embryos can either be transferred to the uterus or frozen for future use. In certain situations, other procedures before embryo transfer, including assisted hatching or pre-implantation genetic testing, PGT, may be recommended. Embryo transfer. The embryo transfer is when a fertilized egg or embryo is placed back into the uterus to develop and potentially result in a pregnancy. There are two main types of embryo transfers: fresh transfer and frozen transfer. A fresh transfer is performed in the same cycle as the egg retrieval, usually after about 5 days. A frozen transfer, on the other hand, involves thawing a previously frozen embryo and transferring it to the uterus. This type of transfer may be done if there are leftover embryos from a previous cycle, or if all of the embryos from the preceding IVF cycle were frozen, such as when genetic testing using PGT is needed as part of the treatment plan, or when more than one retrieval is done to save embryos for future use. An embryo transfer procedure is performed at your fertility center and usually takes 15 to 30 minutes. The embryo selected for transfer is carefully transferred to the uterus through the cervix using a thin catheter. Anesthesia is not typically necessary, as the procedure is usually associated with only mild discomfort. After the transfer, the patient may return home and gradually resume normal activities. In most cases, progesterone will be prescribed to help support implantation. The first pregnancy test can be performed about 9 days later. Patients who understand the IVF process tend to have a more positive experience as they progress through their cycle. In this video, we covered a lot of information, and it's here for you to rewatch at any time you need. We hope that by understanding the steps involved with IVF, you'll feel more confident discussing various treatment options with your care providers and ultimately making informed decisions about your care.